Are you suffering from low back pain with weakness in one side, with lateral pelvic tilt? If you have scoliosis, or you have this muscle spasm in one side, when your quadratus lumborum, which is a muscle from your ribcage to the pelvis, contracts and you feel like you're lopsided. Hi, my name is Annie and welcome back to my channel, Annie Pilates Physical Therapist. In this video, we'll be discussing quadratus lumborum pain and why it's happening. I'm going to discuss a little bit anatomy and physiology, why these muscles is angrier no matter how much you do a deep massage. I made a video about this 3 years ago and I'm updated it again. Plus, I'm going to use dumbbells to strengthen for those next progression. If you find this exercises too aggressive, my recommendation is to go back to my other videos where I slowly progress. So in this video, let me discuss a little bit anatomy about the quadratus lumborum. It's a quadrilateral shape. It's part of the deep abdominal muscles, but its function is actually lateral tilt and extension. So if you isolate one side of your quadratus lumborum, it helps lateral flexion. And then when they come together, it helps extension. And it usually originates, which means it begins on the ilium of your iliac crest, which is on your part of your pelvis that goes all the way parallel together like a quadrilateral shape, and it serves on the transverse processes of your lumbar spine, the top part, and the floating ribs. So that's why when you massage that area and you go deep, be careful, especially the insertion, which is the floating ribs, and they're more unstable. So that's why no matter how much you massage that area, if you don't strengthen it, it becomes angrier and more painful. And that's why I'm here to help and guide you using very light dumbbell. You can use bottled water, canned goods to strengthen and to really engage this muscle with proper breath work. And I have my daughter Bella, who's going to join me today to help strengthen her back to prevent back injuries during her gymnastics and high impact activities. And that's why if you find this too heavy, slowly progress. I have other videos with the quadratus lumborum. There's rectify and align, and there's so much more to really strengthen. So let's begin the program. We're going to start with proper breath work in cross-legged position. And you want to make sure you engage your core muscles. First, place your hands on your abdomen and you take a deep breath through your nose. Expand and exhale. Especially if you have spasm, you want to regulate your nervous system by taking a deep breath. Inhale, exhale. If you have scoliosis, such as dextroscoliosis, which is leaning to the left and the curvature is towards the right, you're going to focus on your left. That's usually your spasm side on your left. And if you have level scoliosis, then you have more spasm and tightness on your right. You need to open and stretch that right side. And take a deep breath. Exhale. So grab the dumbbell. We're going to start in cross-legged position. If you find this too challenging, cross-legged, you can use the soft foam roller. If you need a good, reliable foam roller, check the link below and you can access my very soft foam roller. And so if you're seated a little bit elevated, it's easier to open your hips out in the seated position. So inhale, exhale, open. So this is your tight side. You open your tight side. Gentle. Try not to overarch like that. Just gentle opening. We can just slowly beginning. And then if this is your good side, you just straight up. And breathe out. Stand up straight. Try not to tilt your head on one side. Keep it straight. Inhale. So I'm pretending this is my spasm side. I'm opening it. A little bit leaning. Breathe in. Breathe out. Straight up. Elbow down, straight down, and reach to the other side. Inhale. Building the upper body strength. And this will support your quadratus lumborum and your hips as well. So make sure you punch up to the air first before leaning. Breathe in, breathe out. Last set. And exhale. Okay, my friends. So the quadratus lumborum, when they're tight, your hip area, you feel like it's hiked in one side. And then the rib cage goes down. So it's really spasming and you can really see the unevenness of your pelvis, even your shoulder like this. So you want to make sure we open this, not just from your hip, but from the rib cage. So now we're going to do a little bit twist to the left. Inhale, exhale, punch this way. And then breathe in and then twist to the other side. Exhale. If this side is your problem side, then do that side only. But for those, I'm doing alternating just to show you how it looks like on the other side. So try not to tilt your neck. Try just to focus on your ribs, rotation, and then reach. Breathe in, expand your rib cage, exhale. The gentle rotation is good to isolate a little bit of your deep multifidi, which supports your erector spinae, your spinal muscles. It's part of your core. Breathe in, breathe out. Last set. And last one to the other side. So in this video, it's a little bit progression because we're using a foam roller for support and at the same time, massage, self-myofascial release. Remember in my video before, we're scooting left and right to strengthen your Quadratus Lumborum. We're going to challenge by placing your ankles on top of the foam roller. Lower the dumbbells down. And then, if you want to challenge, you can hold it. For those beginners, you can just let it go. And you're going to scoot left and right while the foam roller is massaging your calf. This is 3 inches foam roller. You don't need a thicker one because it's going to be challenging. So as I scoot for at least all the way to the end of the mat, as you breathe in and then breathe out. So the foam roller massages your leg at the same time, challenges a different kind of release and challenge. So I have these dumbbells, it really challenges my core. Breathe in, keeping my back straight. And it helps bend your knees a little bit because if it's straight, you might start hunching your back. You don't want that. So keep your back straight. And that's why, if you want, you can place the foam roller for beginners underneath your knee so it's easier to scoot. But for those advanced level, you can keep it at the end all the way to the ankles. Keep your back straight. It really stretches your back and your hamstrings as you scoot forward. And my recommendation is do this 10 times. Breathe in and then breathe out. Okay, after scooting back and forth, now we're gonna start strengthening the side of your rib cage. So we're gonna use the foam roller for extra instability and challenge. So if this is your weaker side, this is what we're gonna strengthen. We need to build the isometrics first, and then the other side, we're gonna build strength and flexibility. So we're gonna switch to the other side. First, let's build stability. So let's pretend my right side is my painful side. I'm gonna lift up my hips up to a side plank with the foam roller and then lift opposite arm and breathe out. And hold this for at least 5 seconds, hold, do it 10 times and then lower yourself down, making sure your hand is level to your shoulder so you're not straining your shoulder joint. As you breathe in, breathe out, lift, keep it stable. We're building stability isometric for 5 seconds with your breath. And then down. Inhale, exhale, lift. Inhale, exhale, down. Inhale, exhale, lift. Breathe in, breathe out. Last one. Inhale, exhale, lift. Inhale, exhale, down. So that's the challenge. And then for the next progression, if you can't follow along yet doing this, you can just do lifting. But for those who want to join, you can do clamshell with side plank. Are you ready, guys? As you breathe in, breathe out, lift, and then clam, which is opening your knee out. Breathe in and breathe out. Hold it for 5 seconds and then down. And if you can't hold 5 seconds yet, you can just do 1 to 2 seconds for absolute beginners. And if you're in a lot of pain, you want to slowly progress. Breathe in, breathe out, lift, and then clam. Hold it for 5, 4, 3, 2, 1. So do that 10 repetitions as well. If you want to do a follow along video, just leave a comment down below and I'll do a follow along video just for you guys. Okay, now let's switch to the other side. This time, I want to open this area. Remember, we talked about we want to lengthen the cramp and tight. At the same time, we want to strengthen your glutes as well. So first, let's lengthen. So we're going to do the same thing, but this time with a little bit overhead reach. So with your knees bent, hold on to the foam roller. As you breathe in, breathe out. We're going to do the same side plank, modified with your knees. And then this time, instead of just keeping it up, we're going to overhead reach to really stretch that area. And breathe out and hold it for 5, 4, 3, 2, 1. And this is what I said about scoliosis, right? If this is your concave side and your usually right side is a level scoliosis, which is a curvature to the left, and you're leaning to the right, you want to open that area. Okay, my friends, as you breathe in and do that 5 seconds, hold 10 times as well. Inhale, exhale, lift, first pointing to the heavens, and then as you exhale, overhead reach and breathe out. And then after 5 seconds, go down. Breathe in, breathe out, lift. Making sure your knees are together. And then overhead reach and stretch. And down. And do that 10 times. I'll do 2 more times with you guys. Okay, my friends, if you want to follow along video, just leave a comment. I want to follow along on this one. 2 more to go. Breathe in, breathe out, lift. Making sure there's no increasing pain, just a gentle stretch. And down. Last one, my friends. Breathe in, breathe out, lift. And overhead reach. 5, 4, 3, 2, and 1. Well done. Now, we are going to do some lovely rotation. So rotation is one of the great exercises to stretch the tightness of the quadratus lumborum. Even though their function is lateral flexion and extension, when you do a little bit rotation, because it inserts in the transverse processes of the lumbar spine, it helps to a gentle, deep stretch. Okay, my friends? So from here, exhale, lift, and then rotation. Down, and then look up. Down, look up, squeeze your core in. Down, and up. 2 more and do this 10 times on the area where you have the tightness only. And that's how you do it. And now, don't forget the clamshell. We did the clamshell on the other side. And usually, the Quadratus Lumborum, it's also weak on the foundation. But it's more common to have that compensation on the right because the gluteal muscles on the left is a crisscross pattern is weak. So just in case, just to compare, do the clamshell as well. Why not? Even though you're targeting the other side of the hip, it looks like this should be weaker. Usually this is actually stronger, but don't forget to isolate that area as well. It will help support on your overall muscle strength. It's also, you can do 2 more sets on the left side. It's this left side where you have a lower pelvis is usually weaker. So what we did earlier, the clamshell, we did 10 reps. You can do 5 reps on your right. And it's okay to do a little bit of that. Okay, my friends, lift, side plank, and then clamp. 5, 4, just 5 repetitions. You don't have to hold. 3, just to mobilize the hips. 2, and 1. And that's how you target those areas. Okay, my friends, we're going to stretch now. We're going to cool down by doing a mermaid position. So mermaid position helps lengthen and stretch this area. So grab the dumbbells if you want. So 90-90 position. Your knees level to your hip. Then your foot out. Your knee at the back is out like this. And then you're going to reach up to the heavens this time. Breathe in, breathe out, and lift the back knee out. And then down. Breathe in, breathe out, lift, and stretch that hip. Inhale, exhale, lift, press up, and then lift the back knee. And do that 10 repetitions as well. Last one. And we can progress by doing forward flexion on your shoulder and then twist to the right. So I'm focusing on my right and lifting the back knee. I'm going to have a deeper stretch. Feel the stretch and then back center and down rest your shoulder. Breathe in, breathe out, press forward, twist and lift. You're going to feel your hip groin muscle releasing, and this will help your Quadratus Lumborum to really stabilize. And my recommendation, if you're lopsided like this, that's fine. It takes time to lengthen and keep your back straight, especially if you have scoliosis. Press forward, twist, and lift. And then let's compare to the other side, and you might find, hey, it's so much easier to do 90-90 position on this side, and that's okay. And it's good to do both sides. So first, you press up, and then lift the back knee, and then down. And you might find so much more flexibility away from the Quadratus Lumborum area, and it's okay. And do that 10 repetitions as well. Make sure you breathe out as you press up. Inhale down, exhale, press up. And do that 10 times. And the next progression with your shoulder forward, twist and lift. Center and down. Breathe in, breathe out, lift, twist, lift, down. It's a lot of flexibility, right, my friends? And that's it. I'm hoping you enjoyed this lovely follow-along video for the Quadratus Lumborum. It's not still follow-along. It's just a gentle progression. If you want a follow-along video, just click the link. Just comment down below. Say you want follow-along video on this amazing program. And there's so much more to progress to help your one-sided pain and weakness. If you love this video and want to learn more about Pilates, yoga, and physical therapy, please subscribe to my channel. Ring the bell so you won't miss anything. Like and share this video. Every like you give to my channel, you are supporting me. And I'm going to have a one-on-one coaching very soon. Comment down below. You can click the description below and get a free call with me so I could assess your spine, if what's going on your lumbar spine, to fix it for good so you regain life without back pain, to have a stronger core and improve overall posture. Thanks, Bella, for joining me again today. Until my next video training, if you have more time today, watch my very first video about Quadratus Lumborum pain and this video align, which is the next progression. Until next time, always remember, be safe, be well, and healthy you. Bye!